Hey, this is Anthony Carey with Function First and the Pain-Free Movement Specialist. And here are a few slides I'm going to share with you from some of my past presentations that I think will really help enlighten you in terms of understanding or reinforcing some of the concepts of chronic pain that we've shared with you in the past. And equally important, add some clarification to yourself and know where you have control with exercise and how important it is towards you living the life that you want to live. So first of all, you're not alone. It's a major, major problem, more than cancer, heart disease, and diabetes combined. So understanding that, we know that it's a big problem, and it's a big problem that does not respond just to medications for a lot of people. And for many folks, there's a lot of frustration that goes along with how they've been either treated by their physicians or whether the people understand what's going on, and really a loss of empowerment that goes along with that. So therefore, we're hoping that just some of these facts will at least get you pointed in the right direction or reinforce some of the reasons why you're continuing doing what you're doing. So first of all, understanding the difference between acute pain and chronic pain is something that will, again, probably help you direct maybe even who you go to for help. Because with acute pain, you know, there's, as it says, there's a very clear mechanism. We can typically see or associate some tissue damage, whether that's inflammation, discoloration. It responds well to things like ice heat and medications. And the duration of it is only going to be for hours to potentially weeks. On the flip side of that, very often there's no clear mechanism, although we may tie it back to something that happened a long time ago. We can experience the pain and nobody can see anything going on with it. Can't really say, oh, I understand why that hurts. Only we experience it. And if it's more than 3 months and it starts to be chronic or even inconsistent for 6 months, and many people will experience these bouts of these pain episodes for years and years at a time. And even if they're less than 3 months, the reason why that's important is because it creates adaptations into our nervous system and within our brain that add to the chronic condition of the pain itself and all the secondary changes that happen in the sensitization process within our nervous system. So if there were, some of these things are really important for us to understand, and these are consistent from the literature of why some people will are more prone to chronic pain for that matter. But the things that we're really going to want to concentrate on most of all initially is going to be our lifestyle and behavior things that we can control. So if you're a smoker, if you do consume especially excessive alcohol, lack of physical activity, poor nutrition, and sunshine and vitamin D, therefore outdoors activity, all of those are things that we have within our self-control, self-efficacy that we can work on as part of the different levers that we can pull for our own health and well-being. Along with that also goes body weight, and if we're not getting enough sleep. Think about if all of these are contributing together for any one individual, they're going to be magnified. So again, we don't have to change the world very often, but a lot of times, if we can start to intervene with, again, a lever at a time, we can start to move the needle in the direction we want to go. And as it relates to the biopsychosocial side, especially the psycho and social side, if we can, what our individual beliefs and attitudes are around pain and what we think the underlying causes or who's responsible or who's ultimately going to get us out of it, or if I'm destined to live this way for the rest of my life, all those kind of things will impact how quickly you move through this. So from an exercise standpoint, exercise, if we look at the top box, exercise-induced hyperalgesia is basically an increased sensitivity to exercise. What happens if we haven't been exercising, we have a fear of exercise, we have these beliefs that exercise is not good for us, and that we'll be afraid to exercise, and therefore we stay away from exercise and we're inactive. Then what happens if there is an opportunity for us to get back involved with exercise, or somebody convinces us, or we go to physical therapy, and all of a sudden exercise starts to, we try to exercise, but we don't have the tolerance, that sensitivity increases, and you can see the self-perpetuating loop there. That's why it's so important to work with somebody that understands your pain, and also somebody that's going to sort of progressively move you towards exercise in a very strategic and structured way, and not push you into anything too aggressive, obviously, but at the same time, give you a sense of authority, basically, over what you're doing so that you can kind of progressively move in the direction where you expose yourself to a little bit more, but without sort of getting to the point where I describe as unringing, where we can't unring the bell, where we've aggravated things so much, or we've inflamed things so much that what we have done instead is really reinforce that loop. So being a cycle, we can intervene at some point and we can interrupt it. But you have to do that in a smart and strategic way, and not just the no pain, no gain. For the chronic pain person is not a smart strategy whatsoever. So just a couple of highlight things that I've shared in the past with many people is that if we are doing some corrective or restorative exercise, that's a great way to start exposing ourselves to some movement, especially novel movements that kind of remove mechanical stress from our body. Being able to use breathing to control or down-regulate our system is also great, because what ends up with pain is we go into our fight or flight. Okay, non-provocative exercises that are aerobic in nature, because that influences the brain chemistry in a different way than more challenging exercises. So that's great for all of us. Quality sleep. Stay away from foods that irritate our gut, because what they do is there's a gut-brain communication, but there is also the fact that, especially if you have lower back pain, we can aggravate it, actually aggravate with our gut. Stay hydrated. And from the social aspect, or the mind or the sense of fulfillment, get around people you enjoy, have those social interactions, do something that means that's meaningful to you from the standpoint of contributing to your family or to your community or expanding your knowledge, whatever it is. But all of these things, again, are ways that we have control, and we can improve our overall outcomes and how we can move past chronic pain. And it may be progressive, but it's going to happen. Don't give up. If you have any questions, feel free to reach out. Please like the video below if you can, comment on it, and we'll be happy to jump in. Thanks for your time.